Hello everyone, welcome to Sahyog program. You are watching PM eVidya channel. I am with you, Dharmendra Singh. This session belongs to a very good topic because schools are about to open and what preventions we need to care about. We are going to discuss about these things. So I've got a couple of panelists with me. I will definitely introduce them with you one by one. But before this, if you have any query related to this, you can get back to us on our telephone number. You can see on your television screen very quickly. 8800440559. You can call us back and tell about your queries. We will try to solve this out with the help of our experts. And secondly, you can also send your questions, your suggestions through mail on our official mail ID of Sahyog, which is sahyog.ncert@citnic.nic.in. To watch this program live, you can tune in PM eVidya channel from 6 to 12, and also you can watch this program live on NCERT official YouTube channel. So let me introduce the topic, which is safe schools during the COVID-19. To talk about more, let me introduce first. Please welcome Honorable Professor Animesh Mohapatra, Head of DESM, and he is joining us from RIE Bhubaneswar. I welcome you, Professor Mohapatra.
Thank you, Dharmendra ji.
Along with him, I would like to also welcome Ms. Ranita Karmakar, and she is a practicing counselor. I welcome you, Ms. Karmakar.
Thank you, Dharmendra.
All right, so without wasting any more time, let's start our session and try to understand the atmosphere, how it will be once we are going to open our school under the COVID situation, which is not ended yet, still going on. So, Professor Mohapatra, what safety measures to be taken by the parents while sending their wards to school, and also what should be the role of school as well, because they are opening that school once again, so they need to also find out some way how they are going to start once again from a new manner.
Okay. So before we start discussing the question, then first let me just tell you a few lines that this coronavirus is transmitted through direct contact with respiratory droplets of an infected person, which is generated through coughing and sneezing and touching surfaces contaminated with the virus. Well, all of us know the outbreak of coronavirus disease in late December 2019 has wreaked havoc across the world. Education of children has been hit hard, and it has caused a severe disruption to our education system since February 2020. The government closed schools to ensure health and well-being of our children. Many children have experienced mental and emotional stress during the period of school closure. Particularly in our country, COVID-19 has affected a large number of students across states, across regions, gender, caste. Shutting down of the schools and the decision of shifting traditional classroom to digital platform has not only increased learning inequality among children, but also pushing a large number of children out of school due to digital divide. The mental health children is dangerously deteriorated, struggle to cope with the socio-economic COVID-19 pandemic. Having some threatening, altering conflicts, ongoing fear, and chronic stress is compounded by the daily anxiety, uncertainty, and hardship produced by this COVID pandemic. Now the time has come, that is to back to school. Well, as you know that government has opened schools for higher classes right now, but soon all will be able to return to school. But things will be very different for quite a long time. When we are opening the schools, everyone has a role to play. Community, parents, school administration, teachers, supporting staff of the schools, everybody has a role to play for well-being of our children. Now, as the question is asked, what safety measures to be taken by parents while sending their wards to schools? Well, first is before sending your children to schools, you must ensure that they are vaccinated wherever it is possible, and you must go for RT-PCR test. So parents, it is necessary that parents should ensure that children to get COVID-19 vaccine to protect them from getting infected and reduce that is transmission. What kind of readiness by the parents? You can see that is while sending children to wards to your school, you see that they are properly, that is with the mask, which is must, that is proper mask, and that is you sanitize their bag, you sanitize their whatever that is tiffin box, everything you need to, that is sanitize. And when you are coming to drop them to the schools, and you see that there is no overcrowding in the schools. So, and best is that determine a queuing system for students on arrival and a process for staff to greet or escort students only as necessary, and integrate thermal scanning. That is very important. That is when the children are coming to school, scanning is very much important. And queuing zones, that space from 1 meter apart from each other, you can make in the picture as you see that should be. And parents are standing at the back, and this should not make overcrowding in the, that is school. Well, then comes that is parents should be designated drop-off and pick-up points before the school gates, or entry and exit points, with the exception of parents for students with disabilities who require that is assistance. Then comes that is priorities or active and non-motorized transport to support physical distancing, and this is very, very important. I encourage our children that is wherever possible, that is promote walking or cycling to reduce crowding on school buses and public transport, and provide more space for those who must use these modes of transport. Now, using active transport also helps reduce motorized traffic, allowing prioritization of essential deliveries and emergency services. And if you go, that is come by walking or cycling, help students to spend their time outdoors. This is crucial to their physical and mental health. Very much important for them, especially when opportunities such as recess and sports are limited for physical activities. Now, that is, we cannot allow much sports activities in the schools because there will be crowding, there will be touching each other. So then during that period, we can encourage that by cycling or by that is walking, which will be beneficial for them. And this administration at the same time must see that the school bus must be disinfectant, that is before it is leaving the school to pick up the students, and there should be proper sanitizer at the door when the children are entering into school bus. They should sanitize their hands and avoid overcrowding in the bus, and assign seats to students if that is possible. Now you can see on this side that is overcrowding in the school bus. This should be that is avoided. And inside bus all should come with that is wear mask, including the pilot of the bus or the conductor of the bus. Everybody should have to maintain this COVID protocols. And at the same time, you should not encourage your children to come to school by using that is private vehicles. Now you can see private vehicles will be always overcrowded, and that is parents should avoid all these things. So these are some of the things for the parents to maintain all these things. Then that is words will reach the school safely with good health. Then I think I took little time, that is in anything left you can ask me. You can go for the next question.
Definitely, sir. I will come back to you again. But yes, the picture which you have already been shown to us, that is absolutely phenomenal, because if we are going to start once again, that we need to gear up a few more things from the new way, actually, because the reopening will obviously having the strict COVID-19 rules and regulations. If you are going to start with, then you need to maintain that cure as well from your end, how you can sanitize the atmosphere, how the atmosphere should not be full crowdy, minimum people if you can gather over there. So actually you can 20 to 25 students can join the class at a time. So I think these should be the strategies where you can start with for the new normal if you ask
Yeah.
about. So all right, so right now talk about how the opening of school is going to help well-being students, Ms. Karmakar, because we are starting again, so there should be lots of questions, lots of dilemmas in the mind of students because they are going to face a new thing now, which is not the oldest one that, okay, school is opening, we are going to meet our friends, our teachers, and we are going to make a fun, we are going to learn so many things, but there should be some kind of fear in their mind as well. So how they should face this?
Thank you, sir, for the question. You see on the screen right now, I have just tried to depict what is going on in the mind of the children while they are coming to school. When the school were closed down, you can imagine in the locked doors what the children have gone through. So there were anxiousness in them, they were confused, overwhelmed, nervous, and many underwent depression. If you go to the next slide, kindly let us go to the next slide, you will be able to see certain facts on the screen where 10 to 20% increase in malnutrition in India due to COVID-19. There are other facts also which shows that there has been a sharp decline in the nutritional process. What I would like to say, the first benefit of reopening school in India is not just a source of education, but also provide access to health, hygiene, immunization, and nutritional safety nets. For example, if we take Indian midday meal, it is one of the largest programs in the world, feeding programs in the world, and has been widely studied to have positive associations with an increase in attendance, decreased rates in malnutrition, and prevention of stunted growth across generations. It is important to consider the benefits of reopening schools for students to possible health risk and cost that has caused in the last 2 years due to nutritional loss. It is predicted that India, which aimed to decrease the malnutrition rate by 2% due to our Poshan Abhiyan, won't be able to achieve the target if our schools remain closed. Coming to the next slide, we see. So what we are saying is, like, very crucial part of schooling. What does a child have? The first memory about the school. More often or not, it is about peers, teachers that constitute our definition of school. Even before academic learning begins or rolls in, can you imagine a school life without reminiscing about your peers and teachers? So you can imagine about the condition of our students. These early memories of schools play an important role in socio-emotional learning. So other than nutritional benefit, the second point which I would like to stress upon is reopening of school will help us in developing the social emotional learning of the student which was at the back seat in the last 2 years. This process of young children and adults helps in building their emotions and identities and provide them an authentic relationship, validation with the peers and teachers. So there will be definitely a benefit in social emotional learning when the schools reopen. Another and the last point which I would like to say, other than nutritional benefit and social emotional learning, what you see on the screen is mental well-being. Here, public health experts have stressed that the lockdowns have put 1 in 7 students at a risk of poor mental health. With primary caregivers of children, both parents and teachers, currently juggling health and economic shocks, children are being put into backseat. Even in our National Education Policy 2020, there's a lot of focus been stressed on emotional learning, social learning, and mental well-being. So the closure of institutions during this pandemic has resulted in learning gaps. There is less interpersonal interactions in between the peers and the teachers. There is loss of routine among the children, which leaves the children vulnerable for poor mental health. So for me, the reopening of schools have 3 main benefits: the nutritional benefit, the social-emotional learning, and mental well-being. Thank you so much.
Absolutely, there is no doubt whatsoever. If we care about a few of these things, I think so that is not going to affect us a lot. Although we all know that there has been a mixed experience, in the other states, and we are monitoring, currently heavily on this. So we have a bullseye that we are not going to commit any mistake, that should be from our end or from the parents end, and also from the students end. So we need to care a lot more things about it this time, because we are fighting, such kind of enemy in which we cannot see him, but that enemy, striked you very badly, as we had already been seen a lot of examples, as we have lost it so many loved ones of our family, and there are lots of examples. We do not want to talk about this. Okay, let's move further now. And all right, thank you so much, ma'am. I will come back to you again if time will permit me. I would like to talk to Mr. Professor Mohapatra now. Sir, can you hear me?
Yeah.
All right. So earlier you talked about the transmission of this COVID-19. Okay. So what steps should be taken by the school administrations, top of that related to the operational conditions for preventing COVID-19? Because this COVID-19 transmission is going to be awful. Is it going to be take place again? That might be the possibility. There should be yes, or there should be no partially way. So how we can face this situation?
Yeah, it's a very good question. Now, as we are planning to open the schools, already schools have opened for higher classes, but gradually for lower classes it will open. Now, in our state government of Odisha has already declared that in all colleges, all batches will be coming, students will be coming. So that means schools are also slowly opening up. But it's very important that the children were at for a long time, they are not exposed to the outer world. So suddenly now they will be coming out of their home to the schools, and the parents will be worried for that is what is going to happen, because still that is COVID is prevailing. It is not completely that is shut down. So now what school authorities will be taking care of these children, what steps they will be doing that. Now first and foremost is that before that is calling the students to the school, they must, that is, sanitize the whole building, that is school building. Every nook and corner of the school building should be sanitized properly, at least 2 days before the arrival of the children. Now even classrooms, benches, desks, cupboards, everything need to be sanitized properly. And very important is that is washrooms, toilets, these things to be sanitized properly, and that should be everywhere. That should be provision for cleaning their hands with soaps. Now when teachers are coming to the classrooms, they are bringing various teaching aids, they are coming with books. Those things also need to be sanitized, because these viruses can remain live for few hours on these surfaces. If children will touch these things, they may get contaminated. So these we are still in, that is, many things are not known till now about this virus, and every day there is certain new things are coming out about this. So first and foremost is that is sanitization of that is school building. Then second is that is before the arrival of the children in school, all school staffs, including teachers, administrators, and supporting staffs, they should be, that is, vaccinated. So that is, protect themselves from getting infected and seriously ill with COVID-19 and reduce transmission. And they also should go for RT-PCR test, which is necessary to confirm that there is no infection in them, because they will be directly, that is, coming in contact. Teachers will be in contact with the children. So it is very important that all, that is, teachers need to be vaccinated, that is, and they should come and join with RT-PCR certificate. Then third is that when the children are arriving at the school, so they should maintain, that is, physical distances. Now that should be at the gate, at the entry point, that should be someone with a thermal scanner to check the temperature. It is normal or not. This may take time because in a school there may be 500, 1000 students. So if a single person is there, then it will take long time. So there should be, that is at the same time, multiple staff should be present to go for thermal scanning. At the same time, they should go for, that is, sanitizing their hands and enter into the schools. And then next comes, that is, all the teachers and other staffs and students, they should check each one that they are with proper mask. And these, if they are using this disposable mask, they should see that it is disposed in proper place also. So wearing mask, that means now I think that we do not know how long we'll be using this mask. It has become a part of our life right now because we have to protect ourselves. Then when these children are, that is, coming to school, that is, they should wash their hands, and even after, that is, when they are going out of class, they should wash their hands, and there should be proper soap and or sanitizers, that is, alcohol-based sanitizers should be present. Sufficient amount it should be provided to the school children, because washing hands with soap and water is very much required. Soap and water are effective against this COVID-19 coronavirus. Clean water to be used for hand washing, and all types of soaps are effective at removing this virus. If soap and water or alcohol-based hand wash are unavailable, then hand washing with, you can use also 0.05% chlorine solution, and that is, can be a temporary solution. Then when these children are in school, that you can see that they have to cover their mouth and nose with mask, and teachers need to see that something, because children sometimes they feel suffocation, that is, they pull down their mask from the nose, and so teachers should be vigilant at that time. They should see that, they should instruct, they should orient everybody that it is for your benefit that you should go for.
Actually, so these are the certain things what we need to follow: proper sanitization, vaccination you need to do. We don't have much more time, sir. We need to wind up this session here, but thank you so much for your valuable time, and thank you so much once again for the viewers and also our guest who enlightened us in the best way. Thank you so much, sir, and thank you so much, Ranita ma'am, for your time. Thank you so much once again. And thank you so much all the viewers whosoever watching this program. Tomorrow we will bring once again a very good topic to be discussed about. Till then, you no need to do anything extra. Just be at home, take a very good care of yourself, don't go unnecessary out, and keep watching PM eVidya channel. See you tomorrow. Thank you.
Thank you.